viewing.
Did you know that vaccination against HPV is a cost-effective way of preventing cervical cancer? Well, now you know. We're going to learn this and even more facts on today's episode. Remember, this is Body Garage, the art of well-being, and I'll be your host, Beatrice Watare. Please do stay tuned all the way to the end to learn more about the third most common cancer in women. But first, let's look at the statistics. According to the World Health Organization, an estimated 604,000 women were diagnosed with cervical cancer worldwide, and about 342,000 women died from the disease in 2020. In Africa, approximately 80,000 women are diagnosed with cervical cancer, and 60,000 die from the disease annually. The study in 2018 also showed that 33 per 100,000 women in Kenya have cervical cancer, and 22 per 100,000 women die from the disease. According to the International Agency for Research on Cancer Global Incidence, Mortality and Prevalence, there were an estimated 5,250 cervical cancer cases and an estimated 3,286 deaths in Kenya in 2018. Now that we've been able to have a wonderful conversation with one of our case studies, with me here is an expert. And remember, this is where we're going to be ensuring that we get all the facts right. And joining the conversation is a health expert, Daktari. Habari yako?
Mzuri sana.
Please do introduce yourself.
Okay, asante sana. So my name is Dr. Buruna Mwita, an obstetrician and gynecologist, and currently doing my fellowship in gynecology oncology. Yes.
That's interesting. I mean, why do you choose to call it a fellowship? All right.
Yes.
But anyway, I asked you and you told me it's a fancy word, But anyway, Daktari, thank you so much for joining the conversation today. And, first things first, what is cervical cancer?
Well, cervical cancer is one of the spectrum of gynecological malignancies. Basically, it's a cancer affecting the cervix, which is basically the opening of the uterus. It's a very devastating disease to the patient herself, to the immediate family, and the community at large.
Mm-hmm.
Okay. So looking globally at the statistics we have for cervical cancer, we report 500,000 new cases every year, with 250,000 dying at the same in the same year. So in our setup in Kenya, we report about 3,000 cases with about 1,500 deaths annually. So you can see the effects of the disease.
Yeah.
Yes.
It's literally half
it's
of the
literally,
people who get it.
Yes, die from it. And the unfortunate thing is that cervical cancer is actually preventable through robust screening and vaccination programs, which are all available in our setup.
Yeah.
Yes.
And at the start, I had told people watching that you can actually prevent the cervical. I've heard you calling it cervical cancer rather than the usual cervical. But yeah, cervical cancer, you can prevent it through the HPV virus vaccine. Sorry. So I understand that we have different types of the HPV virus, right? So which particular one causes the cervical cancer?
Usually for the HPV, the human papilloma virus, we have over 200 strains, but about 14 of them are able to cause the cancer. But the commonest ones that cause cancer, about 70% of them is the HPV 16 and 18. Yes.
So does the vaccine also capture that as well?
Yes, we have three types of vaccines available. So there's one that covers 2 of the viruses, the HPV 16 and 18, and another covers 4, and we even have one that covers 9 of the viruses. Yes.
Oh, right. And I understand that, cervical cancer is all about the female reproductive system.
Yes.
So at what age is one more predisposed to the cancer itself?
Well, what we have to know is that the human papilloma virus is sexually transmitted. So what we say that is that as long as you're sexually active, you have to be screened for the disease. But in our setup, we see cervical cancer commonly around 35 to 45 years of age. But that doesn't exclude the other age groups. Yes.
Right.
But it's very rare below 20 years of age. Yes.
Okay. And maybe just to understand, if one actually has the cervical cancer, what are some of the early signs and symptoms that one can detect, and go get a diagnosis or something of the sort?
So usually with cervical cancer, and that is why we should promote more of the screening, the vaccination. At the early stages, it will be difficult to know. But once you get maybe to the later stages, you'll get these people presenting with bleeding, and the bleeding mostly is after sex. We call it post-coital bleeding, low abdominal pains, foul smelling, discharge, loss of weight. Okay, but now that is in the later stages.
And I'm very much curious, can you actually conceive after a recovery?
Well, with the disease, especially with the early stage disease, we have what we call fertility sparing surgeries, where we can remove part or whole of the cervix, that is if you desire fertility. But at later stages, that will be difficult.
So it's really important to make sure you go for regular screening.
It is very, very important, yes, to go for screening, especially now that, as I said, they are available at all levels of health facilities that we have in our country. And in our setting, usually, depending on your status, HIV status, it could be yearly or after every 3 years, depending on the results that you get. So if you have had regular screening, then we can safely stop at around 65 years of age, as long as you have had 3 negative screens years prior to getting to 65. Okay. Yes.
Yeah, and maybe personally, I'm asking myself. So, which hospitals can you get screened? Is it at any medical center that you go to?
As I said, any level of health facilities in our country. Yes, even level 1, they can do the basic screening. The one I talked about, the visual inspection, those ones can be done from that facility. Yes, so that should not be a reason not to go for screening, that facilities are not available. They are available, yes.
Okay, and maybe now moving down to the treatment part, apart from what maybe the treatment entails and the radiotherapy, chemotherapy. So after getting diagnosed and you've actually started the journey towards recovery, so what are some of the lifestyle habits that you need to adapt, nutrition and stuff like that, to make sure you speed up your recovery?
Well, during the recovery process, or even during the treatment from diagnosis, one of the most important things that you have to get is the social support to allay the anxiety, the fear that one may have, especially with the diagnosis of cancer. And this is where the family support comes in as a very important component for your general well-being. We have support groups, cancer support groups, where patients actually meet. They meet people who have gone through the same journey, and this actually helps them with the recovery period. Obviously, after treatment or during treatment, usually when we are managing these patients with the cervical cancer, it is a multidisciplinary kind of management, where, as you've said, we need nutritionists to advise you. Okay, we need psychologists or counselors with you to help you through the journey. Yes.
And I think it was just yesterday when I was having a conversation with one of my friends. You know, nowadays, everything people do, they usually update on their statuses. But you don't see, you know, young mothers taking their kids for these vaccinations and posting about it.
There's I don't know, there's that apathy. But you see, as the stakeholders, especially now, you in the media, we in the health, obviously the government would come in strongly. I think it is the information that is lacking. Yes, and it is up to us to actually make sure this is disseminated to the general public. Just like we had campaigns about HIV/AIDS in the 90s, 2000, TB. You know, right now everyone knows about HIV. Everyone knows about, quite a big percentage of people know about TB. We should do the same with cervical cancer.
Very true.
Yes, so we have a big role to play. Yes.
And also other cancers, because I think...
yeah, today we are speaking about cervical, even other cancers, yes.
Definitely. Anyway, but because of time, thank you so much, Dr. Ari, for joining in this wonderful conversation. And I think it's actually one of my favorite episodes, you know, knowing that this is a cancer that you can prevent. This is a cancer that you can go ahead of and make sure that you don't have to suffer all about it when you can actually get vaccinated against it. So definitely thank you so much for joining the conversation once again.
You are watching TV47, the home of untold stories.
Don't wait until the end of the year for you to accomplish that real estate resolution. The Realtor helps you start now by bringing on table available avenues, starting from affordable housing, flexible payment plans, latest designs, as well as the policies affecting the real estate sector. Tune in every Tuesday from 8:30 p.m.
If you gotta be for me.
Yeah, like you see, these are the fabrics we use for the sofas. Yeah, there are different types of fabrics. Sabak.
It is the best way to go. Eat color, eat raw, you know.
Diversities and earthly pleasures.
Yeah, like you see, these are the fabrics we use for the sofas. Yeah, there are different types of fabrics.
We raise it a notch higher as you bust some moves to gospel hits.
Yeah, like you see, these are the fabrics we use for the sofas. Yeah, there are different types of fabrics. Sabak.
It is the best way to go. Eat raw, you know, like this is alive.
Well, 2022 is behind us. 2022.
You're watching TV47, the home of untold stories.
And now that we've been able to get an understanding of what cervical cancer is all about, it's time to dive deep into the treatment procedure. And I think this is a place that most people are curious about and want to know. And joining the conversation is Dr. Wanda with me here. Karibu sana.
Thank you very much. So my name is Dr. Dalcy Wanda. I'm a senior house officer in radiation oncology at the Kenyatta National Hospital. I'm pleased to be here with you today.
Thank you. We are very glad to have you. And right to it, what is radiotherapy and what should a patient expect, you know, going through the whole radiotherapy process treatment?
So radiotherapy is the use of high dose of X-rays to be able to treat and target the cancer cells. So when it's low dose X-rays, that's for imaging, like an X-ray of the chest or using it for imaging of the abdomen. But when the doses are slightly higher, then we use it for treatment. So what a patient would expect is first they'll be able to see a doctor who would be part of the diagnosis process, maybe an obstetrician or gynecologist, where they'll go and tell them of their symptoms. A biopsy will be taken, it will go to the lab, and thereafter the diagnosis of cancer will be made. Following that, then a patient would have to go through what is called staging. Staging means we do imaging to know how far has the disease spread. Is it localized just at the cervix? Has it moved to the other tissues surrounding the cervix, or has it even gone to bone or distant tissues like even the liver? So once you're able to stage the patient, you're able now to decide based on the stage what is the treatment option. Majority of the cases, if it's very early disease, less than stage 1B2, then those cases surgery is perhaps the first line of treatment, and there are various surgeries that can be done. However, after that, after surgery, the tissue will be taken to the lab. If the margins were positive, if there were signs that the disease had extended out of what was already removed, then radiotherapy can be prescribed in that scenario.
Okay.
Another scenario where we would need radiotherapy is perhaps a stage that is above 1B2. So this is whereby even if we would have surgery, then the surgery might not be adequate to deal with the disease process. So we'd need radiotherapy now to target the cancer cells. So how radiotherapy works, those X-rays, the high dose X-rays, they target the DNA within the cell, the cancer cells. And as the DNA is damaged, then those cells do not replicate as fast. As we well know, cancer is a process where a cell is mutated. It doesn't go through the normal process of being born, growing, developing, and later dying off. So that process of normal growth and development is hampered. So how radiotherapy does, it breaks down the DNA so that the cells do not replicate very fast. The cells are not in a position of actually breaking off and going into circulation and going to another tissue.
Okay, so what should a patient expect when receiving radiotherapy treatment?
So what would happen after the diagnosis? You've seen the doctor has been able to prescribe the treatment, then you need to give consent. You need to give the doctor permission to give you that kind of treatment, and that's informed consent. So you'd be explained to what are the side effects, what should you expect. You'll be told about how to manage those side effects. You'll be told about any complications that may arise. Then the informed consent will mean you'll have to put your signature so that you say, yes, I'm totally aware of the treatment you want to give me. I'm aware of the side effects, and I'm ready for this kind of treatment. So once that is done, on the day that you're coming for what is called simulation, you need to come for the planning of the treatment. So you'll come and we'll do imaging. Majority of the cases we do CT scan imaging, and the imaging is a simulatory imaging. So it will show us where the tumor is, so that as the doctors who are in clinical or radiation oncology, we're able to contour, to draw exactly where we want the rays to go to. Because the treatment, we want to really avoid and protect the normal tissues. Tissues that are not affected by the disease really do not need to be treated. So we try and concentrate on the tumor itself, so that the normal tissues aside are quite spared. So that's really important. And then also to know how much dose is going to the critical organs. For example, for cancer of the cervix, we're very interested to know how much the rectum will get, because it's a sensitive organ. Right. Thereafter, once the treatment planning has been done, the contouring has been done, it's been approved, the doctors have looked at it and they see it's a safe treatment plan, the patient will come in for the simulation. They'll be exposed the parts where we want to do the treatment. To ensure that the patient does not rotate during treatment, we normally insert marks, landmarks on the body, which might be like tattoos, to ensure we are going to align the patient with the lasers on the wall. Remember, we are conforming the treatment to something that is within the patient. So any lateral rotation, any movement different from what we set at the beginning will mean that the treatment will miss the tumor. So it's very important for the patient to lie very still. We use immobilization devices. We use a device beneath the knees called a knee rest. We'll use another one at the foot called a foot rest, another one at the head, a head rest. There are times we also use a body bag or a vacuum lock just to ensure the position is really held in place. Once we've done the simulation, plans have been done for treatment. On the very day of treatment, the similar procedure will be done. The patient will be exposed. They'll lie on the flat couch of perhaps the Linac machine, because we'll start with external beam radiation. So once they lie there, immobilization, we confirm the position we had at the beginning in the simulation, so that we've not rotated the patient. Treatment isn't really long. From the time the patient is set up on the machine, within less than 10 minutes, the treatment is delivered. So how the machine is operated, once we are done setting up the patient, the radiation therapists would leave the room. Then the door would close, and then it would be operated at a console. So you'll be able to see the patient, you're able to talk with the patient, but you're not within the room. Yeah, so that in case they're uncomfortable or anything happens, you can be able to talk to them and see what's going on. Then after a few minutes, the patient is done and they dress up and they can leave the room.
Okay, I'm very curious about something. So I'm guessing, is this painless?
It's actually very painless. It's
okay.
comparable to just going for a CT scan or for an X-ray. So the difference is an X-ray, maybe an imaging, you just go once, but for the treatment, then we do it every day, Monday to Friday. So that's the difference, that you have to keep coming to hospital for that to happen.
I get it. So what are the different ways of administering radiotherapy?
So when we talk about cancer of the cervix and the prescription is radiotherapy, then we start with external beam. This means that the machine is giving the rays from the external source. So the patient lies on the couch, as we've discussed, and the rays come from the machine. It's been calibrated, and we have done the treatment planning to ensure the highest dose is going to the tumor itself, and we are, as much as possible, shielding the normal tissues around it. So there are things called MLCs within the machine that are able to help us conform the treatment so that the highest dose just gets to the tumor alone and not the normal tissues that are around it.
Okay, and now since we've gotten to understand that it's not, it doesn't involve a lot, so how often does a patient need it? Say, for example, one diagnosed with cervical cancer.
So pretty much it depends on what is our intent of treatment and whether the patient had surgery or not previously. But most of the time you'd find the patient would need to come Monday to Friday, especially if we're doing a radical dose with the aim of cure. You'll come Monday to Friday, then Saturday, Sunday you'll be able to relax at home. Reason why there's a 2-day break is to ensure that the normal tissues that are getting some of the dose have time to recover. Remember, we mentioned how radiotherapy works. It targets the DNA, and it will target DNA of fast replicating cells. So cancer cells are fast replicating cells that are targeted. Once the DNA has hit it, then that cell is deformed. When it's deformed, it can't replicate as fast and dies off with time. But we need to keep hitting the DNA to have the tumor shrinking and have good response, and that's why the period of treatment is prolonged. Some patients have 5 weeks, that's about 25 sessions. Others might have less, depending on what is the dose per day.
Okay, all right. And at what point, with a patient diagnosed with cervical cancer, at what point would you require radiotherapy as part of your treatment?
So as I mentioned, it's really a continuum from the time of diagnosis and staging of the patient. So based on the staging that you've staged the patient at, that's where the decision is made. That this patient will need radiotherapy, and the dose is chosen, and how many sessions they will get is also discussed, and whether they will need only the external beam or will need to also do brachytherapy. So brachytherapy, it would mean that the treatment is more localized, more closer to the tumor location.
Okay, so I think the thing that I'm most curious about, when it comes to cervical cancer, and I get to understand that, most times when radiotherapy is being performed, or maybe chemotherapy, we get instances of other cells being damaged as well. So how do you prevent it? Is it the whole tattooing thing, does it make sure that it doesn't extend?
Okay, so the tattooing bit is to ensure that the position you had at the beginning where you planned the treatment is replicated. So that ensures you are actually treating the tumor. You don't have a geographical miss because the patient is aligned differently. What else we do is ensure that when we're doing the planning, the treatment planning, we actually just ensure where we want the dose to be is really tight, meaning we're sparing part of the normal tissues. We also calculate to see how much is the dose going to the rectum, because there are guidelines that say how much dose can go to the rectum safely. And if you exceed those doses, then you're going to have more toxicities to the patient. The abdomen and the intestines are also a sensitive organ. So we also calculate to see how much dose are they getting. If the dose is high, then we have to replan the treatment for the patient. So for cancer of the cervix, the treatment can be twofold, using external beam radiation and also using internal radiation, such that the external beam shrinks the tumor and leaves perhaps a small area at the cervix level, which we need now to insert applicators close to that area to deliver radiotherapy for the patient.
Okay, and I think the other thing is, the whole thing about radiotherapy and stuff like that, is it a must for you to actually go through it, especially when you have not just cervical cancer, any kind of cancer?
So the best thing is to actually listen to your doctor, because there are guidelines that outline how you treat cancers. cancer is not one disease, it's actually very many diseases. And even cancer of the cervix, 10 patients with cancer of the cervix might not have the same treatment based on what type of cervical cancer they had, what stage did they present at. So it's really important to have a discussion with your doctor. Most cases in hospital, once you're diagnosed with cancer, goes through something we call a multidisciplinary tumor board, where a group of doctors, the gynecologist, the gyn oncologist, the radiation and clinical oncologist are present. And that makes us come up with the best management plan for an individual, so that we are not making an individual or outside the guidelines. We're not making decisions that cannot be ratified. And the guidelines we use in Kenya, it's very important for everybody to know they're worldwide guidelines, meaning the treatment you get in Kenya for perhaps cervical cancer will be the same treatment you get even if you go to the US, even if you go to India. That's the treatment you would get. So pretty much it's important to listen to your doctor, let them explain to you the whole treatment process. Know what your diagnosis is, what is the plan, what do you need to do and how do you need to do it, so that it's done at the correct time as scheduled as per the guidelines.
Okay, and during this whole process, the radiotherapy treatment, what kind of nutrition and lifestyle does one have to, adapt?
Oh, that's a very good question. I'm sure many people always want to know, because a lot has been talked about when it comes to nutrition, and sadly some of the information is a bit misleading. So the most important thing is to know that there is breakdown of cells. So the radiation itself is breaking down the abnormal cells and some of the normal cells. So what we encourage is a balanced diet. Balanced diet means you have your carbohydrates, you have your fibers, you have your protein, you have your fruits. And we do not encourage strict dietary restrictions, with the exception of perhaps alcohol and cigarette smoking, because those two are known to cause perhaps other mutations that can make you have other cancers. But pretty much if you have a balanced diet, that is recommended. Yes.
Okay, and there's somewhere I was reading, they were talking about you not being allowed, or rather not advised, to take dry foods, especially if maybe the radiotherapy was done at a certain area that's maybe around the neck and stuff like that. So is that something that people need to put into consideration as well?
I guess a lot is written when people are talking about radiotherapy, but really what we're discussing in this particular setting is in the pelvis. Cancer of the cervix means we are treating lower down. So really taking dry foods might not be a challenge, with the exception of perhaps individual patients who have individual needs that are not, you cannot say as a blanket statement all patients with CA cervix would need this kind of diet. However, I think the take-home message should be that dietary restrictions are not something we emphasize unless the patient has a particular allergy, a patient has a particular side effect to a certain food, then that could be restricted. Or they have another condition, like they are diabetic, so we tell them now to limit their sugars, or they're hypertensive, we're talking about salt reduction. But pretty much the diet we want is a balanced diet that's healthy.
Yeah, and I think that's important, because sometimes, when you put so many restrictions, it might even tamper with, the psychological bit of how it all works out. Now, as we conclude, maybe on the last question, I understand that, we can get some complications associated with radiotherapy, chemotherapy. So how do you contain them?
So yes, it's very true. Remember, these are rays that are targeting, yes, the tumor, but they will pass through normal tissues from the skin all the way targeting the tumor. So some of the side effects we've noticed is perhaps skin becoming a bit dry and darkening over time. So that can cause a bit of itchiness. Sometimes there might be a bit of peeling. So what we do for any patient on radiotherapy, we see them once a week to be able to contain those side effects. So when they have skin toxicity, there are creams that we advise them to use. We talk about skin care, how to wash the skin, how to dry it to ensure there is no much bruising. We advise on what other creams to avoid or which ones to apply. There's also toxicity, because remember the pelvis has part of the intestine, so it's important for them. Sometimes they might have a bit of bloating, there might be a bit of diarrhea, but the fact that we review them every week, as the side effects come up, we're able to address them either with medication, those that are maybe psychological side effects just because of the diagnosis, the stress levels that the patient has, then we're able to deal with that, to help them cope with that, have them have counseling. The social worker is also involved, because there's also the financial toxicity of treatment, because you have to travel, maybe you have to have a caregiver, the costs that go with it also causes some psychological toxicity. So really, it's like a whole continuum of care, and the fact that we see them weekly, any of the side effects that come out, if they're a bit nauseous, if they're having diarrhea, if there's a peeling of the skin, then we are able to address that as we go along.
Right. Wow. Thank you so much for sharing in this wonderful conversation. I think now what people need to get is a wonderful case study to understand and to also know that the chances of survival are there, especially with early detection. So please do not go far.
You are watching TV47, the home of untold stories. Are you looking for a college that will shape your future career? At Candy College of Beauty and Applied Sciences, we offer advanced courses with personalized attention to our students. Come and get your diploma or certificate in cosmetology, hairdressing and beauty therapy, diploma in community development and social work, or certification in catering and accommodation operation. We also offer diploma in nutrition and dietetics and many more. All of our graduates have secured employment in the job market, while others have gone into entrepreneurship. What are you waiting for? Join us today. For more information on how you can enroll, visit us at the London Beauty Building, 5th floor, Taveta Road, Nairobi, or call us on 0726 031 109 or 0784 515 606. Facebook, Candy College of Beauty and Applied Sciences, or on Instagram, Candy College of Sciences. Our January intake is ongoing. Candy College of Beauty and Applied Sciences is the cutting edge college.
Kaluma King Herbal Lozenges zinazo nguvu maradufu kutuliza kikohozi, vidonda vya koo na mafua. Kaluma King ni shwari.
Chika mama huyo muharifu kaiba kuku zangu, vifaranga wangu na mayai zote pia kabeba. Haya chika mama huyo.
Maumivu yakizidi, muone daktari.
Imagine starting your academic journey here at the foot of Mount Kenya. A place where you can call home. A place where we celebrate our diversity and uniqueness. A place where you can be at your best, at work and at play. That place is Embu College. There's no better place to make the difference than Embu College. Karibu Embu College, where a holistic education matters.
Hakuna kitu fiti kama vitu kutokea poa kuliko vile umepangia.
Yeah, like you see, these are the fabrics we use for the sofas. Yeah, there are different types of fabrics. Sabak.
It is the best way to go. Eat color, eat raw, you know, like this is a line.
Well, 2022 is behind us. 2023 is here with us. What are your plans? We're here at TV47's Morning Cafe. About information, we're talking about entertainment, we're talking about the greatness for the year. So make sure that you're always with us every morning.
Kwa muonekano wao, hauwezi ukajua waliopitia. Kwa sura zao zinapong'aa, hauwezi ukafahamu changamoto zao. Nyuma yao ipo story na historia. Katika kipindi Ufahamu Kiongozi, tunakupa nafasi kuweza kuwafahamu kila siku ya Alhamisi kuanzia saa 1:30 kuendelea. Nami Elizabeth Mitu.
Your health matters, and Body Garage is here to guide you on it.
Someone's after using the medication, the virus number of the HIV in someone's body will start to go.
My medication, wherever I go, I must make sure I'm committed to my medication. Yes, and I should watch what I'm eating. I should not just eat from everywhere or not just eat anything.
We talk mental, physical, and spiritual health. Join us every Thursday at 8 p.m.
Kwa majina ni Esther Mudhoni kutoka Nakuru na nimeokoka. Yesu ni Bwana. Mimi kujua dalili zangu za kansa nilianza na kubreed. Sasa nilikuwa nafikiria ni ile period yetu ya wamama. After 3 days inarudi. Halafu ikikaa tena inarudi. Mimi nikakaa tu hivyo, nikafikiria tu ni hii shida tu ya kazi, na nikaendelea tu kwa muda nikibreed, sababu ilikuwa inaacha kama wiki moja, after wiki kama ingine moja inarudi. Sasa nilikuwa nafikiria tu ni hiyo, nikakaa nayo, ikaanza kukua ile mzito. Si breed hii wa mama tunakuaga nayo for 3 period, ile tunakuaga nayo for 3 or 4 days. Sasa ikaanza kuwa mzito. Mimi nikatulia tu na sikuwa nafikiria inaweza kuwa shida. Nikakaa nayo almost 6 months kama inatoka hivyo. Sasa kama sisi wa mama ni kujipanga, tunajipangaga, nilikuwa najifunga tu vizuri, lakini hakuna wakati nilikaa kwa nyumba. Sasa mimi nilikuwa naenda tu job, lakini nikifanya kazi nasikia nimechoka sana. Sasa kitu yenye sasa tuliona si hiyo, sababu nilikuwa nakunywa painkillers. Sababu ya hiyo mgongo nilikuwa sana nakunywa Brufen na diclofenac. Sasa nikakunywa tu, nikaona haisaidii. Sasa ndio nilianza kuumwa sana na mgongo. Tukagiu na mzee niende medical. Mimi nikaenda medical na nikatumwa kwa block 4. Kutumwa huko nikaenda na nikaongea na daktari, wakaniambia sasa nastahili kupelekwa block 21. Mimi nikaenda, daktari mwenye nilikuta huko akaniambia, nikamwelezea shida yenye niliko nayo, na nilipelekwa na daktari mwingine huko. So huyo daktari nikiingia nikamwelezea vile naendelea na hiyo period vile imenisugua, sababu mimi nilikuwa nafikiria ni period. Sababu hii ugonjwa yangu ilikuwa cervical cancer. Sasa huyo daktari akaniambia niende nitafute pesa, ilikuwa 2300 kitu kama hiyo. Niende nikuje nifanywe screening. Sasa nitolewe atika nyama. Mimi nikashindwa hiyo inaenda aje. Nikarudi kwa nyumba, nikarudi home. Mimi kukuja tukatafuta pesa na nikaenda. Ni kweli mimi nilienda na nikafanyiwa hiyo, na nikaambiwa nirudi after niwape namba ya simu, alafu watanipigia. Kama result itakuwa imetoka kabla 3 weeks watanipigia. Kama itakuwa zaidi ya hapo nijirudishe huko medical, ndio wanipe result yangu. Nikakuja nikakaa for 1 week. Kukaa nikapigiwa simu, ilikuwa siku ya Friday. Nikapigiwa simu nikaambiwa natakikana medical. Wakaniuliza niko wapi, nikawaambia niko tu within Nakuru. Sasa nikaenda, wakaniambia, nikawaambia nikuje, wakaniambia hapana, masaa imeenda, wacha ukuje Monday sababu kesho hatufanyagi. Sasa nikasema tu ni sawa, nikagojea Monday. Mimi nikaenda niliambiwa niende straight kule kwa kutolewa damu huko lab. Mimi nikaenda na nikasema jina yangu, nikatolewa na nikawaambia siku yenye nilifanywa testi. Sasa nikaenda wakanipea result yangu. Sasa kunipea result ndio nikaambiwa niende block 8. Kwenda block 8 nikakuta daktari. By the way, nashukuru, naambia Mungu abariki Dr. Wanda, sababu yeye ndiye nilikuta huko na alinikansel vizuri sana, akanipea hope, sababu mimi niko na mtoto moja, lakini akanipea hope sana. Akaniambia hata alizaliwa akiwa mmoja tu, bora tu nipone. Sasa nashukuru Mungu sababu hao madaktari hawakuniambia direct ati niko hivi. Sasa kitu yenye walifanya, walinituma huko block 8. Sasa huko block 8 bado huyu daktari hakuniambia direct vile mimi niko. Sasa akaniambia akinipea maadvice hivi na kunikanso ndio aliniambia uko hivi. Lakini hata kama uko hivyo, mtu anaponaga tu, utumie dawa vile unastahili na ufanye vile tu unaambiwa na daktari. Wakati niliambiwa vile kuko, niliambiwa tujaribu nianze kemo, na nikaandikiwa nifanyiwe kemo 6, na akatuambia vizuri vile hiyo kemo inastahili kufanywa. After siku 8 naenda kutolewa damu ndio nionekane kama niko na damu. After 3 weeks ndio nilikuwa naenda kuwekwa kemo. Sasa tukaambiwa sababu mimi sikuwa na kadi ya NHIF. Sasa tuliambiwa kama tuko na kadi, tukawaambia hatuna kadi. Tukaambiwa twende tutafute 24,000 alafu after that tujaribu tukate kadi ya NHIF. Sasa tukaenda na tukatafuta. Nilianza hiyo kemo na by the way ilinipeleka, sababu hiyo kemo nilikuwa na side effect mingi. Ya kwanza nikaanza kutapika lakini uzuri ni tulikuwa tumepewa tumekansoliwa yote ati inakuwa na side effect. Kwa hivyo kenye mtu alikuwa anapatana nayo tulikuwa mimi kwangu nilikuwa nimeshajua naweza patana na hii, naweza kosa kupatana na hii. Hivyo mimi kwangu nilikuwa nimeandikiwa ilikuwa 6, lakini yenye ilinipeleka sana ni ya kwanza. Ndio sasa ielewanwe na damu yangu, sababu ilifika niliwekwa after masiku yenye walikuwa wameniambia niende nikatolewe damu, nikakutana si na damu. So ilibidi niende ward ndio niwekwe damu ndio niendelee na hizi kemo zingine. Zote by the way niliwekwa 5 sababu ilinipea side effect ya miguu. Sasa sikuweza kumaliza ya 4 sababu walijaribu na mimi sana. Walijaribu all the way sababu ilikuwa the more naenda nawekwa ina affect sana. Sasa ikafika pahali nashikiliwa, mmoja ananishika hapa, mwingine ananishika hapa ndio nitembee. Kwa chakula walikuwa wanatuadvise sana tukule protein na matunda, na tena tukurage masaa mingi, tukurage sana na vitu ziko na nguvu, sababu hizi dawa bado zilikuwa na nguvu sana. Sasa ilikuwa hivyo, yani ukule vizuri, ukiweza usikule nyama ya ng'ombe, ukule kama nyama ya fish ama ukule kitu kama omena, vitu kama hizo zenye ziko na iron. Sasa wakati nilimaliza kemo nilipewa time, ndio sasa ni relax, ndio niendelee na treatment, sababu ilifika pahali nikatumwa Kenyatta. Sasa ndio niende radiotherapy. Kwa hiyo muda nilipewa muda wa kupumzika 1.5 mwezi. Na tukaenda Kenyatta, na Mungu ni mwaminifu, nikapata nafasi na wakaanza kunitibu. Nikafanyiwa radiotherapy 29. Na hiyo 29 nilikuwa naenda kila siku. Na ukianza hakuna kuacha. Sasa nikaenda na nikamaliza hizo radiotherapy yote. Kumaliza radiotherapy nikapewa nafasi ya kupumzika 1.5 month. Ndio niende black therapy. Na nikaenda black therapy, nilikuwa nimeandikiwa 3. Nayo black therapy inaendagwa 1 per week. Kama umepewa 3 unaenda wiki 3. Na zote Mungu aliniwezesha na nikamaliza. Sasa niseme niko sawa, sababu hiyo wakati nilikuwa nafanyiwa hizo makemo hizo zote treatment, mwili yangu ilikuwa inachoka sana. Nikifanya kazi kidogo nasikia nimechoka sana mgongo. Nilikuwa nasikia kuchoka mgongo sana nikifanya tu kazi. Tena hizo side effect kama hii ya miguu yangu ilikuwa imekufa kutoka hapa kwa magoti mpaka chini. Sasa the more naenda ndio inaenda ikirudishaga nguvu. Sasa kitu yenye iko mtu mwenye ako na hiyo side effect anastahili kukunywaga maji. Sana kukunywaga maji. Na nilimaliza na nikarudi Nakuru Hospital. Na nikawauliza hii miguu tutafanya aje, sababu iko hivi. Hiyo wakati nilikuwa naenda na mti. Wakaniambia hiyo haina shida, sababu ni side effect, itaenda tu ikiishaga. Sasa kitu yenye naweza kuambiwa uko na kansa si ati ni kukufa, sababu magonjwa ni mingi inauaga watu, inatoaga watu kwa hii dunia. Kwa hivyo kitu yenye iko ni kujiamini, sababu ukikosa kujiamini uone kifo utakufa. Lakini kama unaamini ati nikikunywa hizi dawa Mungu utaniponya, utapona. Na usistuke, hii ugonjwa hastakagi mtu anastuka. Tu ni kujiweka mikononi mwa Mungu na unatii. Yenye unaambiwa unatii. Kama ni kuenda clinic vile unastahili, kama ni hizo chemotherapy, inastahili date yenye umepewa, uende hiyo date. Sababu zile dawa zinaishaga nguvu hiyo that day. Kwa hivyo inataka tena iendelee ndio ikusaidie. Kwa hivyo ukianza wewe umepimwa, umeonekana uko na kansa, kitu ya kwanza acha kuona ni kufa. Mimi natoa ushuhuda, nilipona. Na nilipona sababu sasa hakuna kazi siwezi jifanyia. Ile breeding nilikuwa na breed, niliwekwa dawa ya kwanza. Nafanya job yangu, mtoto hawezi niitisha Meron.